While you're watching this right now, somewhere in the world, someone has just lost the ability to speak forever. In the next 60 seconds, several more people will lose control of half their body, and the reason is almost always the same. No one around them recognized the warning signs in time. 2 weeks ago, I received a message that still weighs heavily on me. A man wrote to me and said, "My wife had a stroke right in front of me. I thought she was just tired, maybe dizzy. I waited 2 hours before calling emergency services. Now she's in a wheelchair for life." 2 hours. That was the mistake. Because when it comes to your brain, you don't have all day. You have 3 hours. After that, the damage becomes permanent and irreversible. But here's the part most people don't know. There is a test that takes 10 seconds, literally 10 seconds, and those 10 seconds can be the difference between walking tomorrow or never walking again. In the next few minutes, I'm going to teach you how to recognize a stroke in just 10 seconds using 4 simple signs that even a child can understand. I'll show you exactly what to do in the first 3 minutes to save an entire brain. And most importantly, I'll explain how to reduce your risk so this never happens to you or someone you love. Because the truth is, nearly 80% of strokes are preventable. If you value being able to speak tomorrow, walk tomorrow, recognize your family tomorrow, do not leave this video. What you're about to learn can save a life. My name is Dr. Charles Bennett, and I want to tell you something. Doctors often don't explain clearly enough until it's too late. A stroke does not discriminate. It doesn't care if you're 30 or 70. It doesn't care if you eat healthy or run marathons. Statistically, 1 in 4 people watching this video will have a stroke at some point in their life. 1 in 4. Look around you for a moment. Count 4 people you love: a parent, a spouse, a friend, a sibling. According to the data, one of them will suffer a stroke. It could be you. But here's the secret that can change everything. Your brain warns you before it happens. It sends signals. It begs for help. The tragedy is that most people don't know how to listen. Think of your brain like a city. The blood vessels are the roads. Oxygen and nutrients are the traffic that keeps everything alive. Now imagine one of those roads suddenly becomes completely blocked. No oxygen, no fuel. The buildings start shutting down one by one permanently. That is a stroke. And every single minute you wait, nearly 2 million brain cells die. 2 million. Those cells do not regenerate. There is no reset button. There is no second chance. It's like burning pages out of a book. Once they're gone, that information is lost forever. Those pages might control your right hand, or your ability to say, "I love you," or the memories of your children's faces. But there is a treatment that can reverse this damage if it's given in time. It's called TPA. It dissolves the clot, restores blood flow, and saves brain tissue. But it only works within a very narrow window, roughly 3 to 4 hours from the moment symptoms begin. After that, it doesn't matter how good the hospital is, how experienced the doctor is, or how much money you have, it's too late. That's why recognizing a stroke immediately is everything, and that's why you must learn this now. 4 letters, 10 seconds, 1 life saved. The FAST test was created by emergency neurologists after watching thousands of patients arrive too late. Their question was simple: how can we make stroke recognition so easy that anyone can do it even without medical training? The answer became FAST. The letter F stands for face. Look directly at the person and ask them to smile. If one side of the face doesn't move, if the smile looks crooked or drooping, that is not normal. That is a stroke. You may notice one side of the mouth sagging or one eye not closing properly. This happens because the stroke is blocking the part of the brain that controls facial muscles. The letter A stands for arms. Ask the person to raise both arms straight out in front of them as if they're holding a tray. If one arm drifts downward, falls uncontrollably, or cannot be lifted at all, that is a stroke. It's like the brain suddenly loses its connection to that arm. The arm is there, but the signal is gone. The letter S stands for speech. Ask them to repeat a simple sentence, something like, "The sky is blue." If the words come out slurred, mixed up, incomplete, or don't make sense, that is a stroke. Sometimes the person knows exactly what they want to say, but their mouth won't cooperate. This is terrifying for the person experiencing it, which is why staying calm and acting fast is critical. And finally, T stands for time. If you see even one of these signs, you call emergency services immediately, not in 5 minutes, not after you wait and see. You do not give them water. You do not give aspirin. You do not drive them yourself to the hospital. You call 911. Paramedics can begin treatment on the way, alert the hospital in advance, and take the patient directly to a stroke-ready unit. This alone can save 20 to 40 minutes. And those minutes often decide whether someone fully recovers or lives with permanent disability. When you call, write down the exact time the symptoms started. Take out your phone, look at the clock, write it down. That information is more important than anything else you can tell the doctor. Let me share a real story. Carlos was 52 years old, an engineer, healthy. He ran 3 times a week. One Saturday morning, he was drinking coffee with his 19-year-old daughter. Suddenly, he dropped his cup. At first, she thought he was just clumsy. Then, she noticed his face looked strange. She remembered a video she had watched just weeks earlier, 4 letters fast. She asked her father to smile, one side of his face didn't move. She asked him to raise his arms. His right arm dropped instantly. She asked him to repeat a sentence. The words wouldn't come out. She grabbed her phone and called emergency services. My father is having a stroke. Symptoms started 2 minutes ago. She wrote down the time. The ambulance arrived within minutes. The stroke team was ready before they even reached the hospital. From symptom to treatment, less than 1 hour passed. Today, Carlos has recovered almost completely. He walks, he speaks, he works. His neurologist told his daughter, if you had waited even 30 minutes longer, your father would likely be paralyzed. You saved his life. That daughter later wrote to me and said, I'm not a doctor. I just remembered 4 letters fast. And here's the question I want you to think about right now. If someone you love has a stroke tomorrow, would you know what to do? Now, FAST detects most strokes, but it does not detect all of them. And this is where many lives are lost. There are additional warning signs that people mistake for harmless problems, and that mistake costs them everything. I need you to remember these signs just as clearly because some of the most dangerous strokes don't look dramatic at first. The first hidden warning sign is a sudden explosive headache. Not a normal headache, not tension, not migraine. This is often described as the worst headache of my life. It appears within seconds, like a thunderclap, as if something exploded inside the skull. This can indicate a hemorrhagic stroke where a blood vessel in the brain has ruptured and is bleeding. This is an absolute emergency. Call 911 immediately. Every second matters. The second sign is sudden vision loss or visual disturbance. One eye goes dark. Vision becomes blurry. Double vision appears without explanation. This means the stroke is affecting the optic nerve or the visual processing center of the brain. The third sign is severe, dizziness combined with loss of balance. This is not mild lightheadedness. The room spins violently. The person cannot walk straight or stand without falling. This often indicates a stroke in the cerebellum, the part of the brain responsible for balance and coordination. The fourth sign is sudden confusion. The person doesn't know where they are, what day it is, or who the people around them are. In older adults, this is sometimes dismissed as dementia or just age. But if it appears suddenly within minutes or hours, it may be a stroke. The fifth sign is numbness or tingling on one side of the body. An arm, a leg, or an entire side suddenly feels disconnected, heavy, or completely numb. The sixth sign is difficulty swallowing. The person suddenly cannot swallow saliva or chokes easily. This can indicate a stroke affecting the brainstem, one of the most dangerous locations. The seventh sign is sudden nausea and vomiting without food poisoning or illness, especially if combined with any of the other symptoms. Now listen carefully because this next part costs more lives than almost anything else. Sometimes the symptoms appear and then disappear. The arm works again. Speech returns to normal. Vision clears and the person thinks that was strange. But I'm fine now. This is a fatal mistake. What just happened may have been a TIA, a transient ischemic attack, often called a min-stroke. This is your brain sending a final warning, a cry for help. 40% of people who experience a TIA and ignore it will suffer a major permanent stroke within the next 3 months. 40%. I treated a man named Roberto, 68 years old. One Sunday afternoon, his right arm suddenly stopped responding. 5 minutes later, it returned to normal. He told no one. 2 weeks later, he suffered a massive stroke, permanent paralysis. His neurologist told him through tears. That first episode was your warning. If you had come in that day, we could have prevented this. If symptoms appear, even briefly, go to the emergency room immediately. Do not wait. Do not sleep it off. Do not assume it was nothing. Now I want to give you the exact emergency protocol. This should become automatic. If someone is having a stroke in front of you, minute 0:15 seconds, perform fast. Face, arms, speech. One positive sign is enough. Minute 15, 60 seconds. Call 911. Say clearly, this person is having a stroke. Symptoms started at exact time. We are at exact location. Write down the time symptoms began. This is critical. While waiting for the ambulance, lay the person down with the head slightly elevated, 1530 degrees. Loosen tight clothing. If they vomit, turn them on their side. Speak calmly. Reassure them. Do not give food, water, or medication. Do not drive them yourself. Now, here is the most powerful truth of all. 80% of strokes should never happen. They are preventable. The number one enemy is high blood pressure. High blood pressure causes nearly half of all strokes. Ideal blood pressure should be below 20/80. Never ignore medication because you feel fine. High blood pressure is silent and deadly. The second enemy is diabetes. Uncontrolled blood sugar damages brain arteries. Keep HbA1c below 7%. The third enemy is high cholesterol, especially LDL. It creates plaque in brain arteries just like rust in a pipe. The fourth enemy is smoking. Smoking triples stroke risk. 2 years after quitting, risk drops by 50%. Let me tell you about Teresa, 65 years old. She had every risk factor: high blood pressure, diabetes, high cholesterol, obesity, and smoking. Her doctor told her bluntly, "You are months away from a major stroke." She changed everything, quit smoking, walked daily, took her medication. 1 year later, her stroke risk dropped from 45% to 8%. She wrote to me and said, "I thought it was too late at my age. I was wrong. It is never too late." Now here is what you must do today. First, train your family this weekend. Teach fast. Practice it. Make it automatic. Second, create a medical information card. Name, conditions, medications, allergies, emergency contacts. Keep it in your wallet and by your bed. Third, post fast signs in your home, refrigerator, bathroom, bedroom. Fourth, set up emergency medical info on your phone. Paramedics can access it even when your phone is locked. Fifth, run a drill every 6 months. Practice recognition and calling emergency services. Families who do this save lives. I've seen it with my own eyes. When we began this video, someone in the world lost the ability to speak forever. In the time you've been watching, dozens more have had strokes. Some arrived in time, some didn't. The difference was not luck, it was knowledge. You now have that knowledge. 4 letters, fast, 3 hours. 80% preventable. Now it's your responsibility to use it. Like this video so it reaches more people. Subscribe so you can protect your family. Share this video urgently and comment below. I am prepared. I'm Dr. Charles Bennett. Protect your brain. Act fast.